Are you struggling with obesity or do you know somebody who is? Well, here is Dr. Erica Podolsky on the surgical options that might be available to you. Dr. Podolsky, welcome to our show. How are you?
Good, thank you.
Okay, so we're going to spend 8 minutes talking about bariatric surgery and procedures and who's a candidate, but let's start with this. What exactly is bariatric surgery?
So bariatric surgery is thought of as a weight loss surgery. It's actually a metabolic surgery also, but it's for severely obese people. It's now most commonly a laparoscopic surgery, so minimally invasive surgery. There are a few different procedures. Commonly either a sleeve gastrectomy or Roux-en-Y gastric bypass, which has been the gold standard for a long time, but it is a surgery.
Do you have to be a certain amount of pounds overweight to qualify for it?
It's about 100 pounds overweight. It's easy to go onto Google and Google BMI, which is a ratio of height and weight, and that's what the indications go by. So anyone over a BMI of 35 qualifies for surgery.
Is this a first resort, a last resort, a somewhere in between resort for people who want to lose weight?
It's actually the only durable treatment for obesity. So back in 1991, the NIH claimed that surgery should be offered for people that are obese, and we know that diets don't work after a certain BMI, and that's why it's indicated for 35, but not below.
But let me jump in with that then. So, all right, I would think that somebody would first be encouraged to, I know you just said diets don't work, but lose weight, exercise, start eating healthy.
Sure.
Are you saying don't even bother with that because it's not going to work?
Absolutely do that. I mean, everyone should have a healthy lifestyle, and that's a big component afterwards. You have to change the way you eat, change your lifestyle, but at a certain point, at a certain weight, people just can't get back to a healthy weight without surgery.
That's interesting. Is it biological? Is it hormonal? So in other words, somebody comes in and they qualify, and they say, you know, I've tried all these diets, they don't work. Why are they not losing the weight? Do you know? Do people know?
Sure, there are a lot of factors. So some people have a genetic factor that sets them up for obesity. Our diet in this country sets people up for obesity. There's all this fast food, all you can eat kind of buffets, and a lot of it's environmental and what people are used to. So there is a big change in lifestyle associated with the surgery. But I think what people don't realize is that once somebody becomes obese, fat cells kind of take on control of their body. So they have hormonal changes and physiologic changes that just make it almost impossible to really lose the weight and keep it off.
That's interesting. So when a layman says, why can't that person just lose the weight, it's not as simple as them just eating a salad or whatever.
Right.
Yeah.
It's a chronic inflammatory state. It's difficult to lose weight. It contributes to a lot of other medical problems, even cancer.
Right. Not just the physical, but the mental. I would imagine people come into you and they're probably depressed.
Sure.
Right? They feel ostracized in the community.
Right.
They're anxious, right?
Yeah, I mean, they can't socially interact with people. It prevents them from going to school events for their kids or grandkids. So the number one reason that people actually get to the point of surgery is usually for quality of life.
Would anyone not be eligible to do it?
A lot of these people do develop medical problems, so each person has to be evaluated individually, but there's no absolute contraindication really.
Young, old, doesn't matter.
Right, doesn't matter.
Yeah. What would be the youngest age that you've operated on or you've seen someone or something like that?
I don't do pediatric surgery, but it is popular in the pediatric population.
Really?
20% of our kids in this country are obese, not just overweight, so it is an epidemic even in kids, and Michelle Obama has a whole campaign for childhood obesity. So I personally don't do pediatric surgery, but it is an option for kids.
But children are getting the surgery because even as a child, you've already established that they are going to be obese if this does not happen.
Yeah, I mean, they already are obese, and you have to look at risks and benefits with anything. So if the surgery is too high risk, those maybe aren't the best candidates. But for kids that have obesity their entire lives and develop medical problems and social problems and psychological problems, surgery might be an option for them.
Yeah, you've seen, maybe you haven't, but I've seen these shows, my 600-pound cousin or all these ridiculous shows, right? And you look at these people and it's so sad. But I'll be honest with you, sometimes I've watched them and I've thought, well, they're just lazy, or why, throw in a salad every now and then.
I think that's what everyone thinks, and unfortunately that's why we don't treat obesity well in this country. We treat less than 1% of obese people in the right way.
Is obesity a disease, much in the way as alcoholism is a disease?
Right, it's a disease.
Right.
The American Medical Association a few years ago labeled it as a disease in itself. Mm-hmm. It is a precursor to other diseases, but it is a disease, and it's also an addiction. You mentioned, smoking, alcoholism, food becomes an addiction.
Right. How much weight might somebody lose if they have one of these surgeries?
So we usually look at it with excess body weight. So you can kind of Google your ideal weight, and you should lose probably somewhere around 70% of your excess body weight and get back to a healthy BMI.
Lose it right away, right after post-surgery?
It's gradual for the first 2 years, but in the first few weeks after surgery, you probably have a 20-pound weight loss. It depends where you start, but the weight loss is pretty rapid to start. It extends over about 2 years.
And I feel like I have a working idea, much as many of our viewers do, about physically how it works. But explain it. So somebody now they've had the surgery, they lost the weight. So now going forward, their stomach fills up quicker, they don't ingest as much food, right?
So there are a couple different mechanisms. There's one surgery that's a sleeve gastrectomy, which is making the stomach smaller. So the stomach goes from the size of a football to a banana. So you get some restriction on how much you eat. You feel fuller quicker. The biggest thing with that is you don't feel hungry. So the hormonal change by removing part of that stomach gets rid of hunger.
That's interesting.
Yep, and bypass is similar. It involves a little bit of a malabsorption procedure. The stomach smaller, you get rid of hunger. The other biggest change is the physiology of the body. So people that have diabetes are immediately cured from their diabetes.
Immediately? Wow.
A lot of patients go home from the hospital not taking diabetic medications.
That's incredible.
And hypertensive medications. Yeah, it's really life-changing.
Any adverse side effects from the surgery?
Sure, any surgery has risks. So you are dividing the stomach, so there's a risk of leak immediately. These patients typically have other medical problems, so they're at risk for medical complications like blood clots, pneumonias, wound infections, things like that.
Is it a fairly long, cumbersome surgery? What is the actual surgery like?
Surgery takes 1 to 2 hours. It's usually about 2 days in the hospital. Patients are walking the same day of surgery. And then, again, go home probably with less medications than they came in.
Wow. So as we get ready to say goodbye, any advice to anybody watching who maybe didn't think this was an option for them or is perhaps considering it?
Right. I think people should look up their BMI, see if they qualify. 35 or above, again, is an indicator. I think it's important, too, if you know people that are obese or have family members that are obese, not to be judgmental and really approach them with surgery as an option.
All right, so people want to get more information, they want to reach out to you, how do they do it?
Sure, so I'm at Delray Medical Center. The website is delraymedicalctr.com. You can also probably just Google Delray Medical Center. I do have an office which is in Boca because I'm at Delray and Boca. My office number is 561-939-0455.
Okay, there's no excuse because she just gave like 9 ways to contact her, so now you have to do it. Good to see you, and we'll see you again soon.
All right, great.
Thank you.
Thank you.
You got it.